We've now been able to limit the size of our incisions, but in particular with newer implants and instrumentation, we can achieve much earlier recovery and return to near normal function much faster than before. They used to say we had like wrist fractures, particularly in older women, but also see them in older active men. You pretty much were after 50, you're going to live with the deformity, and that's the way it is. I now have seniors that live alone that are in their 70s and 80s, and now can go back and live by themselves after a wrist fracture and take care of themselves within about a month or so. And they give them their independence back and their life back, which before they'd have to have a weak, deformed hand and sometimes either have to move in with a relative or go to some kind of assistive living.
Not every surgery is a major surgery. The key is to diagnose the problem, pinpoint the actual illness, and try to do the least amount possible to most effectively get the maximum result and benefit for the patient. And let's be honest, most patients are afraid of surgery, and that's the normal response. If they're not afraid of surgery, then they're not thinking through the surgical process clearly. So I take my time and speak to my patients to that effect. I need to tell them about the gravity of their problem. Oftentimes I treat them without surgery, but if they need surgery, we have a very qualified staff here, and I've been doing this for quite some time, so I know exactly what to offer them, and we get them back on their feet as soon as we can.
The concept of the Orthopedic Institute is it's an all-one sort of one-stop shop in the fact that you have the clinic where you can be evaluated and seen for your problem. We have lab services there. We have MRI and X-ray there, so you can do those special imaging studies. We can also do your nerve studies there. And then also the surgery center and the hospital are there if you require that. And especially they have the therapy center, which has both physical therapy and occupational therapy, which within the therapy center, they also have the ability to do workman's comp rehabilitation and retraining. So from everything from diagnosing what's wrong with you and further studies to evaluate that to treating it and rehabbing you is all in one building.
I'm Dr. Hushang Suraj. At Orthopedic Institute, if you hurt, we'll heal.